You've been lied to your whole life. They told you masturbation is dirty, that you should give it up once you hit 50. But here's what no one ever says, and what modern science is now proving to be the exact opposite. After 60, masturbation isn't just normal. It can be the line between staying healthy and falling apart. A Harvard study of nearly 30,000 men found that those who continued to ejaculate regularly had a significantly lower risk of developing prostate cancer than those who didn't. I've spent over 30 years treating men like you, and I've seen far too many times the quiet damage caused by neglect, shame, and misinformation. I'm Dr. Benjamin Hartwell, urologist and men's health specialist. I've seen men walk out of my office with worry in their eyes, convinced their bodies are past their prime. But in many cases, it's not about age. It's about not knowing how to care for their sexual health. Here's the truth. Most older men either masturbate the wrong way, or worse, stop altogether. They don't realize that how you touch yourself, how often, and for what purpose can affect your hormones, your heart, and even your brain. A single act that seems harmless if done wrong can contribute to erectile dysfunction, depression, and prostate problems. But done right, it can help boost testosterone, improve sleep, and keep your blood vessels strong. This isn't just about pleasure. It's about maintaining function, restoring connection, and fighting aging at its source, your nervous system. In just a moment, I'm going to share 7 secrets that every man over 60 should have been taught decades ago. Before we go on, ask yourself this. If a small part of your daily routine held the key to better health, a better mood, and more energy, wouldn't you want to know what it is? Keep watching, because what you're about to hear could completely change how you live the next 10 years. And a quick reminder, if you haven't already, hit that subscribe button and turn on the notification bell. That way, you won't miss any real science-backed health information designed specifically for men at this stage of life. If this message resonates with you, type 1 in the comments. If it doesn't, type 0. Your feedback helps me create content that truly matters. Now let's start with the first truth most men never hear until it's too late, because the way you've been masturbating for years, even decades, no matter how familiar or harmless it seems, might actually be quietly working against you. Secret number 1. ED isn't just part of getting older. It can be an early warning sign of something far more dangerous. In over 20 years of practice, I've seen countless men come in for the problem no one wants to talk about, only to leave with a referral to a cardiologist. I'll never forget Daniel, 66, a former Marine. Even in his 60s, he was tall, broad-shouldered, and had a firm, commanding voice. That day, he walked in and said straight out, "Doc, for the past few months, I've had trouble keeping an erection, but I guess that's just age, right?" I didn't rush to answer. Instead, I asked, "Do you ever feel more tired climbing stairs? Ever get short of breath after just a short walk?" He paused for a moment, then nodded. "Yeah. Lately, I get winded after just a few steps, but I figured that's normal." We ran a few basic heart tests. The results showed severe coronary artery narrowing and a dangerously high risk of a heart attack. Without that awkward visit that day, he might not have survived his first one. This isn't rare. According to the Princeton Consensus and the American Heart Association, erectile dysfunction can appear 3 to 5 years before heart disease is diagnosed. The reason? The blood vessels in the penis are much smaller than the coronary arteries, so they speak up first, but most men ignore it, chalking it up to age or stress. With Daniel, I immediately referred him to a cardiologist for artery treatment and designed a circulation-boosting plan for him. Daily exercise, a diet rich in blood vessel-friendly foods, and natural methods to improve blood flow. 3 months later, he came back with a big smile, fresh off a treadmill stress test without any chest pain, and said, half joking, half serious, "Doc, now both my heart and the other part are working great again." ED has never been just a bedroom issue. It can be an early warning sign that saves your heart and your life. And even if your heart is fine, there's another habit quietly switching off your sensitivity that many men fall into. Secret number 2, unconscious, rushed masturbation and the trap of reprogramming your body. I once met Arthur, 69, a retired mechanical engineer. Normally, he spoke with the clarity of a lecturer, but that day was different. He leaned back in his chair, eyes turned away, voice barely above a whisper as if afraid someone might overhear. "Yeah, I still take care of myself, but only in one specific way. And even then, it doesn't mean much anymore." When I pressed further, he admitted that for years he'd always followed the same formula, same hand, same position, same pace, and always the same kind of visual stimulus. At first, he thought it was a harmless habit. In reality, he'd been unknowingly reprogramming his own nervous system. Neurological research shows that when the brain gets used to just one type of stimulus, its ability to respond to real-life experiences, which are naturally more varied, drops sharply. At first, you might only need a small change to feel aroused, but over time you have to speed up, add more pressure, find stronger images. Eventually, anything outside the formula feels too slow, too light, and unable to get you there. Worse, when with a partner, the awkwardness and lack of rhythm create emotional distance. Some men begin avoiding intimacy altogether, feeling ashamed of their bodies, and withdrawing. This can lead to PIED, porn-induced erectile dysfunction, or anorgasmia, inability to climax, both increasingly common in men over 60. I gave Arthur a reset exercise. No visual material, switch hands, change positions, slow down to half the usual speed, focus on breathing and the sensations spreading across different parts of the body. I told him, don't force yourself to finish. Let your body remember how to enjoy the process. Arthur hesitated, but agreed to try. 3 weeks later, he came back with brighter eyes. He said that at first it felt strange, even uncomfortable. But one night, he realized he could feel so much more with just light touches. More importantly, he'd been intimate with his wife without the awkwardness. Masturbation isn't the enemy, but when it becomes a mindless mechanical act, you're like a driver stuck on the same road over and over until you forget how to turn down another path. And sometimes the reason you lose sensitivity comes from something even more silent, something you may not even know you have. Secret number 3, poor sleep and sleep apnea, OSA, silently drain your testosterone. A few years ago, I met Richard, 71, a former semi-pro fitness coach. Even in retirement, he kept a regular workout schedule and ate a clean diet. Yet he came to me because his sexual health had taken a sudden dive, trouble maintaining erections, a sharp drop in libido, and constant fatigue. When I asked about his sleep, he answered right away, "I get 7 to 8 hours, doc, but I wake up tired every morning. My wife says I snore like a chainsaw, and sometimes I stop for a few seconds, then gasp for air." I immediately suspected sleep apnea, OSA, a condition many underestimate, but one that can be extremely dangerous. We ordered an overnight sleep study, and the results were alarming. Every hour he had up to 28 short pauses in breathing, enough to drop his blood oxygen significantly. Research shows OSA can lower natural testosterone, cause erectile dysfunction, and create chronic fatigue. Each time oxygen drops, the body triggers a stress alarm, suppressing growth hormone and testosterone production. OSA also raises the risk of high blood pressure, heart disease, and stroke, meaning it can wreck your sex life and threaten your life. We set up a treatment plan that included using a CPAP, continuous positive airway pressure machine at night, losing a small amount of weight to reduce neck fat, adjusting sleeping position, adding breathing and tongue exercises to help open the airway. 3 months later, Richard returned beaming. "Doc, I'm sleeping a solid 7 hours straight, and I wake up feeling light as air. My wife says I only snore like a kitten now. And, well, things in the bedroom are back to full power." Sleep apnea isn't just loud snoring, like many people think. It's a silent thief that steals your testosterone, your energy, and your intimacy. And if you don't catch it, you could lose far more than your sexual health. But even with good sleep, there's another factor, a true survival factor, that, if ignored, could cost you your abilities forever. Secret number 4, not maintaining erectile function. Use it or lose it. I remember very clearly the story of Patrick, 74, a former saxophone player. He spoke about his life with a sparkle in his eyes until we touched on the subject of sexual health. That's when his smile faded. "Doctor," he hesitated, "I haven't been intimate with my wife for over a year." partly because her health isn't great, but also because I'm afraid of failing. I asked, "When you say failing, what exactly do you mean?" He looked down, his voice dropping. "I can't maintain it. And honestly, I rarely try on my own anymore." I explained it to Patrick this way. Your body is like a musical instrument. If you don't play it for a long time, the reed dries out, the valves rust, and the sound loses its resonance. Erections work the same way. If you don't play regularly, it forgets how to perform. We began a regular circulation activation program, advanced Kegel exercises to boost blood flow, using a vacuum erection device 2 to 3 times per week, a diet rich in natural nitrates, beets, leafy greens, scheduling gentle, pressure-free intimacy sessions with his wife. 6 weeks later, Patrick came back carrying his old saxophone. He told me that one night, while playing a few notes for his wife, the emotions came flooding back and my body just knew what to do. It's living proof of the principle, use it or lose it. If you don't maintain it, you'll lose it. And once it's gone, getting it back is a far tougher battle. But even men who stay consistent can fall into another trap, a deep psychological one that makes them hold themselves back. Secret number 5, shame in self-touch and sexual repression. I've met many men, but few stayed in my thoughts as long as Richard, 71, a retired high school teacher. When he walked into my office, his handshake was firm, but his hand trembled slightly. After some small talk, I asked gently, "Do you still maintain a sexual life?" He flinched a little, then shook his head softly. "No. I just think at my age, it's not something I should be doing anymore. I was taught that touching myself was wrong, sinful, and I guess I've believed that my whole life." Many assume that this kind of shame is just a minor psychological quirk. In reality, it has a deep impact on hormones, circulation, and even heart health. When the body associates pleasure with guilt, the brain releases excess cortisol, the stress hormone, while suppressing testosterone. Over time, this not only kills desire, but also leads to erectile dysfunction, weakened immunity, and a higher risk of depression. I told Richard, feelings don't disappear just because we ignore them. They're like a river blocked by a dam. Pressure builds until it bursts. But if you open small channels, the water flows steadily, nourishing everything around it. We started with very small steps, keeping a journal about his feelings toward intimacy, practicing self-touch without the goal of climax, opening up to his wife about desires without hiding or self-blame, pairing deep breathing with body relaxation to reduce stress. 3 months later, Richard returned. His voice trembled, but his eyes shone. "I no longer feel dirty or wrong touching myself. Now it feels like a natural part of being human. And my wife and we've found each other again." Shame, if left unchecked, is an invisible rope that binds your sex life. Breaking it not only restores your manhood, it returns a piece of dignity and joy you might have thought was gone for good. But sometimes the problem isn't rooted in psychology or habits. It's sitting right there in the pill bottles you take every day. Secret number 6, the medications quietly stealing your manhood. I'll never forget Paul, 68, a former long-haul truck driver. He came to see me looking puzzled, saying that things had suddenly stopped working the way they used to. "Doc, I still exercise, I still eat the same, but lately, it just doesn't work. Does this mean I'm past my prime?" he asked, his voice a mix of worry and sadness. I began reviewing Paul's medical records and found a medication list nearly a page long. Blood pressure meds, diuretics, low-dose antidepressants, and cholesterol-lowering drugs. All of them were essential for his heart health, but nobody had ever told him that some of these could directly affect his ability to get an erection, his desire, and even his testosterone levels. I explained, "Paul, your body isn't betraying you. Sometimes the very pills we take every day for good reasons have side effects that lower sexual function. The key is finding the real cause, not just blaming age." Research from the Mayo Clinic and the American Urological Association has shown that beta blockers, thiazide diuretics, and certain SSRI antidepressants are common culprits behind erectile dysfunction in older men. Working with his cardiologist, we adjusted Paul's treatment plan, switching to drugs with less sexual impact, lowering dosages where possible, and adding natural strategies to boost blood circulation. 2 months later, Paul came back with a rare smile. "Doc, I never thought I'd be saying this at 68, but my wife says I'm just like when we first got married. And I think she's telling the truth." The lesson here is crystal clear. Never assume that every physical change is just because you're getting older. Review your medication list with your doctor. Sometimes one small adjustment can completely transform your sex life. And even if everything inside is ready to go, if you neglect one very specific group of muscles, you can still lose your natural strength. Secret number 7, ignoring pelvic floor strength and lifestyle. One autumn morning, I met Raymond, 71, a former baseball coach. He still had a sturdy frame, but as he sat down in my office, he sighed. "Doc, my heart's good, my blood pressure's under control, but in that department, I'm still weak. I just don't get it." After examining him, I realized his pelvic floor muscles had almost no strength left. These small muscles located at the base of the pelvis help support the bladder and bowel and, crucially, control the blood flow in and out of the erectile tissue. When they weaken, blood can't stay pressurized enough to maintain an erection. I told him, "Raymond, you've trained your arms, your legs, and your abs your whole life, but the most important muscle group for your manhood, you've never trained." He laughed, but I could see a spark of curiosity and hope in his eyes. We started a pelvic floor muscle training, PFMT program, along with lifestyle changes, cutting back on alcohol, getting consistent sleep, and increasing overall physical activity. Research in the British Journal of Urology International has shown PFMT can significantly improve erectile function in men, especially when combined with healthy living. 3 months later, Raymond returned with a line I still remember. "Doc, I can stand tall again, in every sense of the word. My wife says I'm like I was at 15, and this time, I believe her." Don't think pelvic floor strength is only important for women after childbirth. In men, these muscles are the pressure valves for the entire sexual circulation system. If you don't train them, you'll lose that silent power, even if your heart, blood, and hormones are in perfect shape. And when all the pieces, cardiovascular health, nerve function, hormones, and muscle strength are restored, the biggest question becomes, how do you keep that performance for the rest of your life? I often tell my patients that improving male performance at 60 plus isn't a short-term project, it's a lifestyle. You might overcome a specific problem, like Daniel escaping heart disease risk, Arthur regaining sensation, or Raymond rebuilding pelvic floor strength. But if you go back to your old habits, what you regained will slowly slip away. That's why I encourage everyone to create a manhood maintenance routine every day. Regular health checkups, especially for heart and hormones, consistent high-quality sleep, balanced training, cardio for the heart, weights for the muscles, PFMT for the pelvic floor, a varied diet focused on whole foods with minimal refined sugar, keeping sexual and emotional intimacy alive with your partner, not just for the body, but as a lifeline to youthfulness in the mind. I remember a patient named Howard, 74, who once told me during a follow-up, "You know, Doc, I realized the most important thing isn't just that I can do it again, it's the feeling that I'm still living fully." If you're hearing this and wondering, can I really do it? The answer is yes, as long as you start today. The body has an incredible capacity to recover, but it needs steady investment, just like maintaining a vintage car. Remember, performance isn't a gift from youth. It's a reward for discipline, persistence, and self-respect. If today's stories and advice have struck a chord with you, don't let them pass like a breeze. Turn them into action for yourself and for the person you share your life with. Hit subscribe so you don't miss any tips to help men over 60 maintain their health, strength, and confidence. Tap the bell icon so I can send you the latest, easy-to-understand medical insights each week, ready to apply right away in your daily life. And I want to hear your story, whether it's a success, a struggle, or a question that's hard to talk about. Leave a comment below, and either I or the Doctor's Note team will read and reply. Because this isn't just a YouTube channel, it's a community where we stand together to protect and restore men's vitality at 60 and beyond. I'm Dr. Benjamin Hartwell. Remember, your health and confidence are a journey, and I'll be right here walking with you every step of the way.